Staywell's Francis Santos says news from the nation's capital was years in the making.
From the insurance company guys, are very excited that finally something has come down. We've been waiting almost 2.5, 3 years for some kind of relief because of the way the Obamacare Act affected, the territories.
As we reported last week, Insurance Commissioner Artie Logan was informed by the U.S. Department of Health and Human Services that the territories, including Guam, was exempt from implementing certain provisions within Obamacare. This came after several letters and even a resolution from the Guam legislature expressing concern about the negative effects it would have on Guam. The ACA required Guam to implement the market reforms or the essential health benefits, but did not provide the subsidies and mandates to make it work, which would have resulted in an increase in premiums.
It was projected to go anywhere from 50 to almost 100%. And of course that, who would want to face that kind of an increase? And we'll have people basically not buying our programs.
Frank Campillo from Calvo Select Care agrees.
What this does is basically mitigate potential rate increases, correct, and will help the market to continue to be competitive and to continue to flourish.
Campillo says without the news, Obamacare could have been harmful to the industry, especially in the territories.
I believe that so far the change is good. One of the things that we're doing is we having our legal counsels review what exactly are the changes that are going to be away from the island. It's too premature to really decide the actual impact.
One of those changes includes certain provisions in Obamacare that no longer will apply, including essential health benefits. However, according to Campillo, while his legal team continues to review the exemptions, the one related to the dependent coverage of adult children up to the age of 26 seems feasible.
So I think the age 26, the fact that people are getting preventive services without a copayment, I think those will remain in place simply because the market has gotten used to it for the last 3 years.
Santos says it appears the same would apply with Staywell. He says for now, the island's carriers need to get together to discuss how to move forward. In fact, a meeting with Logan, along with Committee on Health Chair Senator Dennis Rodriguez Jr., is set for this week.
I think if we just sit down now with the insurance commissioner and say, look, let's really take a look at this and see what we can do as the industry to help our members.
NetCare's Jerry Crisostomo, meanwhile, says response from HHS is positive. He says the biggest concern was implementing the new market reforms that were set to go into effect at the beginning of this year. He says now the exemptions may help in making rates and premiums more affordable. Take Care's Jeff Larson wasn't available for an on-camera interview, but tells KUAM the announcement is encouraging and that it signifies that HHS has recognized the disparities with the territories. Larson adds there is still a fair amount of analysis that needs to be put together. Reporting for Guam's News Network, I'm Ken Quintaniza.